Hello and welcome to another YouTube video and welcome to another YouTube news review, guys. Thank you very much for joining me on this video. Straight away we're going to the news, which is the UK hospitals death reached 14,000 after 847 patients died today. That's again a big number. We are just seeing a very unstable figures every single day. We're not seeing the line is flattening and the numbers are going down, because 1 or 2 days we'll see the numbers are 700 and then the next following 2 days we'll see the numbers going to be more than 800. Now coming the weekend, Saturday and Sunday, you will see Sunday maybe small figures. Saturday we might see smaller figures as well, because as you know, the most of the places it's a weekend, so they shut, so they don't operate in these hours. And once we get to Monday, we get to see the figures going a lot higher. Like I said, I was reading one of the news today, and they say that we are expected to have 6 waves of coronavirus within a year. So that is a very, very serious news that I've read today, and it's very scary as well, because I'm thinking with the one wave we lost almost 14,576 people have died in the United Kingdom, and that's a big number. You know, we are we're going on a very fast pace, and these numbers are going to grow a lot more. And a lot of government ministers, they're also projecting that these numbers that we're looking at, they're going to be a lot higher. That was predicted. So it's one of those things where everybody just wait and watch what happens. London, as you know, is a very bad hit area at the moment. A lot of people are dying in London. It's a congested area, and it's similar everywhere. If you look at New York in United States, that's a very bad hit area. If you look at Spain, Real Madrid, as again a capital, a very bad hit area. Then we're going back to Italy. Italy is not more central. There's 2 cities called Bergamo. There's one more near Milan. They are the worst hit, and that's where they found a lot of deaths in that area. And then we're going back to France, Paris. Like I said, there's a lot big numbers there as well. Germany and South Korea, they have done really well in terms of handling the situation. They have dealt the matter really well. We are basically, we're just struggling. We don't know which way it's going. All we see is everyday news briefing. There's a blame game started that this virus was released in Wuhan in China, is a biological weapon. Whatever it is, you know what I mean? This is not the time to talk about that. This is the time to find something to cure this virus. We want a vaccine. We don't want this bullshit of it's been prepared in China, it's been planted here or whatever. That's too late. That time has gone. You wasted all that time just looking at each of the faces and see how it comes. I don't think the British government was prepared to tackle this virus. They would just wait and see, this laissez-faire thing, let it be, we will see what happens. There was no precautions, there was no measures in place, there was no lockdown to support the NHS staff, so to release the pressure. There was just wait and watch game, let's see what happens. And this is what's going on now. Every day, almost 1,000, 847, we only shot up 150 deaths. And if we are not counting the deaths as taking place in care homes and in communities, we're almost hitting 1,000, at least 1,000 deaths every day. That's what's been going on for the last 2 weeks. And numbers are going to rise. We're going to see more deaths, because if we don't find a vaccine, I've just read the news now that most of the hospitals in the UK, they're going to run out of PPE by this weekend. So that means we don't have PPE, which is the personal protective equipment for the frontline staff, the NHS, who are working on the front line to fight this virus, dealing with the cases. They won't have any more PPE. Once that's finished, what's going to happen next? Where are we going to go? How are we going to tackle that situation? Are the NHS people going to come to work? Looking at that thing that they know that they're definitely going to catch the virus, because they don't have masks there, they don't have gloves there, they don't have the protective things to wear, or they have the proper the thing they wear that's like a mask type. What we wear is something like a normal, but what NHS staff wear, they must cover throughout their face and their hair and everything. So because they are in direct contact with the coronavirus patients, so they are more at risk, so they need to be prepared. So these situations are getting very, very complicated here. And obviously it's scary as well the way the news are coming. Okay, on one side we are talking about the China virus, that where it was made a biological weapon. On the other side, we're not paying attention on PPE. I'm still listening about the test that we're going to do 100,000 of tests. When there are things that needs to be done on time, not after that when the time has passed. After losing, let's say 20-30,000 people, then we're going to say, yeah, we're doing the test. That's too slow. I'm not sure that this is something that going on. It's intentional, because if Germany can do the test 70,000 tests a day, why can't we do those numbers of tests? Because we were slow to react. And which way it's going, we will find out after a couple of months, when the dust is settles, then we will get to see what happened, what went wrong, and who was responsible. So guys, thank you very much. If you want to share or add anything with this news review, please feel free to do in the comment section below. And if this is the first time you're watching my YouTube channel, please don't forget to subscribe. Thank you very much. And all the reviews that I do, they are purely based on my own opinion, my own thinking, my own analysis. So I'm not taking information from anywhere. I'm not sort of trying to be biased on certain things. It's purely my own neutral analysis, and I hope you guys have the similar thoughts what I'm thinking. So thank you very much for watching. See you next time. Bye bye.